Hi everyone. Today in this video let us discuss Promethazine. What is this drug Promethazine? This is one of the drugs that belongs to the chemical category of phenothiazines. We have few of the other drugs belonging to this chemical category such as chlorpromazine, thioridazine, fluphenazine. All these drugs are phenothiazines, but they are mainly used as antipsychotics. On the other hand, promethazine is not preferred as antipsychotic. Instead, it is used as antiemetic and anti-allergic substance. Even this drug is having the phenothiazine ring system, but it is not used as antipsychotic because of few of the structural differences between the phenothiazine antipsychotics and promethazine. In this promethazine, we cannot observe any ring substitution, but in the antipsychotics, we can observe an electron withdrawing group at the second position. So lack of ring substitution results in weak activity on dopaminergic neurons. Similarly, this drug is having a side chain like this, and this side chain is having further side chain at this position, which is not observed in antipsychotics. That's why promethazine is having the weak activity on the dopaminergic receptors, but it mainly blocks the H1 receptors and the D2 receptors on the CTZ. That's why it acts as antiemetic agent. So promethazine can be used as antiemetic to control nausea and vomiting that is observed post-operatively. This drug can also be used to manage motion sickness, where it is used as prophylactic to reduce the motion sickness. This promethazine can be given before the travel to prevent the induction of any nausea and vomiting. Similarly, this drug can also be used as anti-allergic substance. Since this drug acts as antihistaminergic agent, this drug can reduce the allergic response. So phenothiazine can be classified as anti-allergic substance. Since this drug acts on histamine receptors as well as dopaminergic receptors, it can produce some sedation. So this drug can also be used to induce the sedation before the surgery. For all these purposes, promethazine can be used. And this drug can also be used to control the nausea and vomiting that is developed during the first trimester of pregnancy. But this is one of the off-label purpose of this promethazine, since complete safety is not established during the pregnancy. Now let us see the chemical nature of this drug. So this is the structure of promethazine. Here we can observe one of the amine group is present on the side chain. So let us give the numbering. This is 1, 2 and 3. So simply it is a propanamine. At the second position, amine group is there, so propane 2-amine. Now, at the second position, nitrogen is attached with 2 methyl groups, so N-dimethyl, and at the first position, it is having the heterocyclic ring system. That ring system is the phenothiazine, but the numbering is somewhat different. We have to give the least number to the sulfur, so we can start the numbering from this carbon. So this is 1, 2, 3, 4, 5. Then 6, 7, 8, 9 and 10. So sulfur is given 5th position and nitrogen is given 10th position. And this entire group is attached by 10th position, so we can write this as phenothiazine 10-yle. That is the simple name of promethazine. Now let us see the precautions of this drug. One of the important precautions of promethazine is that this drug on long-term therapy can produce bone marrow depression. Because of bone marrow depression, this drug may produce leukopenia, decrease in the leukocyte count, and neutropenia, neutrophil count is going to be reduced. So the chance of anemia and infections can be increased with long-term use of promethazine. And in those patients who are taking other medications which again reduce the bone marrow depression, such as anti-cancer agents and antiviral agents, with such drugs, promethazine should be carefully given because of pronounced bone marrow depression. Similarly, this drug can induce one of the syndrome, neuroleptic malignant syndrome, which is commonly observed with many of the neuroleptics, that is antipsychotics. Since promethazine can also block the D2 receptors to some extent, it can also produce one of the side effects associated with antiepileptics, that is a neuroleptic malignant syndrome. In this condition, we can observe excessive body temperature resulting in hyperthermia, and some muscle rigidity, muscle spasm can be observed, along with increased heart rate resulting in tachycardia, and confusion can be developed within the patients. So all these symptoms are collectively called as neuroleptic malignant syndrome, which is commonly observed with many of the antipsychotics. Another precaution is that promethazine can reduce the threshold of seizures, so seizure induction is more pronounced in presence of promethazine. This is not that much significant in normal patients, but in those patients who are taking other drugs such as opioids, since opioids can also induce the seizures by reducing the threshold, so the combination of opioids with promethazine may increase the risk of seizures in the patients. Similarly, local anesthetics at toxic dose, they can induce the seizures, so they should be carefully combined with promethazine. Similarly, this drug can produce some respiratory depression, which is more pronounced in the children. That's why this drug should be carefully given in the asthmatic patients or patients with any chronic obstructive pulmonary disorder, COPD. In such patients, this drug should be carefully given as it increases the respiratory depression, dyspnea, wheezing, even it may lead to coma and death of the patient. And finally, promethazine can also produce CNS depression. Because of CNS depression, it can induce the sedation, drowsiness, dizziness in the patients. Again, it is more important when this drug is combined with other drugs like opioids, which again produce CNS depression. And patients should be given caution while driving the vehicles or working with machinery, because promethazine can produce sedation, confusion and dizziness, which may impair their daytime activities, resulting in accidents and injuries. That's why promethazine should be carefully used in those patients who are working with machinery and driving the vehicles. Now let us see how this drug acts. Promethazine acts on different types of receptors. It can block H1 receptors. Similarly, to some extent, it can also block D2 receptors. And finally, it can also block muscarinic acetylcholine receptors. By blocking H1 receptors, it can reduce the allergic reactions. By blocking the D2 receptors at the mesolimbic pathway, it can produce a mild antipsychotic action, and it can also develop few of the syndromes like neuroleptic malignant syndrome. It can act on the acetylcholine receptors, resulting in anticholinergic side effects such as dry mouth, blurred vision, and constipation. But its important action is on the MCs, where it can block the variety of receptors including H1 receptors, D2 receptors, and cholinergic receptors. CTZ is the chemoreceptor trigger zone, which is one of the important centers responsible for induction of nausea and vomiting due to any toxic chemicals ingested into the body. This CTZ is expressed with few of the receptors such as 5-HT3 receptors, which are activated by serotonin, and D2 receptors, which are activated by dopamine. Now, when this CTZ is going to be activated, it can send the signals to the vomiting center, which is again expressed with few of the receptors such as muscarinic acetylcholine receptors as well as H1 receptors. Now, all these mediators are responsible for induction of emesis. So, in order to block the emesis, any of these pathways should be blocked. Now, promethazine works by multiple mechanisms. It can block the D2 receptors on the CTZ. It can also block the muscarinic acetylcholine receptors on the vomiting center. And finally, it blocks the important H1 receptors, thereby it can reduce the induction of nausea and vomiting. That's why promethazine acts as anti-emetic agent. What are the side effects? Promethazine mainly produces sedation, dizziness, and confusion. Somnolence and drowsiness is again produced by this drug because of CNS depression. It can also produce tinnitus, some buzzing noise in the ears. Even it can produce dry mouth because of anticholinergic side effects. Dyspnea, difficulty in breathing, can be produced because of respiratory depression. Fatigue is another important side effect. It can also produce some blurred vision, again because of anticholinergic side effects. How it is given? This drug is available as tablets. It is also available as solution suppositories. It is available at different strengths such as 12.5 mg, 25 mg, and 50 mg. For the treatment of allergic conditions, this drug can be started at 25 mg dose, which can be given as a single dose. Otherwise, it can be given as 12.5 mg given twice daily. For motion sickness as prophylactic, again this drug can be started at 25 mg given before the travel, at least 30 minutes to 1 hour before the travel. This drug should be given in order to reduce the development of any motion sickness. And if it is required, another dose of 25 mg can be given after 8 to 12 hours to reduce the vomiting in the patients. For the treatment of sedation, again this is started at 25 to 50 mg given at bedtime in order to induce the sleep and sedation. But in the children, the dose is somewhat less. It can be given at a dose of 12.5 to 25 mg given at bedtime. So that's about this promethazine, which is a phenothiazine, but because of few of the structural modifications such as no ring substitution and an extra chain on the aliphatic side chain results in a different clinical usage. This drug is mainly used as antiemetic and it also acts as anti-allergic substance. Respiratory depression is one of the important limitations of this drug, which should be carefully monitored. And even it produces CNS depression, resulting in sedation, drowsiness, and dizziness. On long term, it can produce bone marrow depression, which may lead to neutropenia and leukopenia. This drug can be given as an antiemetic to prevent nausea and vomiting, as well as it can also be used as prophylactic in the treatment of motion sickness. Preoperatively, this drug can be given to induce the sedation in the patients. So that's all about this drug promethazine. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.